I'd like to welcome Dr. Misaki Kiguchi. She's the program director at MedStar Washington Hospital Center in Washington, D.C. Um, Thank you, Misaki, for agreeing to this podcast.
It's my pleasure. Thank you, Neil.
So, Misaki has become one of the leaders in venous and lymphatic disease in terms of research and publications, the clinical sciences. How did you start on your journey from this?
I well, thank you for those kind words. I think one of the main things that I love about vascular surgery in general is the commitment, I think, as sort of a field to always sort of push, push for better devices, push for better treatments, push to give better care for each one of our patients. And that's what I really loved overall. But when sort of I started this journey right after training, I really felt that there was a paucity of sort of treatment, optimal treatment plans for patients with such a high burden of disease. The venous disease, I think, sometimes is a little bit overlooked just because you're right, it is not of high morbidity and mortality compared to the arterial side. But because of that, I felt like maybe it was a little bit ignored or pushed to the wayside. But with that, I knew that there was a lot of untapped potential for just treatment algorithms, treatments that we may never have thought of. All of those things really sort of made me really interested in this field. And I have had a lot of sort of just being at the right place at the right time, but as well, I'm surrounded by people who have that same commitment toward treating these patients whose quality of life, I think, is very much burdened by their venous disease. And that quality of life, I think, is something largely hard to measure, but sort of on a day-to-day basis, when I treat patients with, for instance, venous wounds and you heal that wound, it is very, very rewarding to be able to say, you're right, I did something that may not necessarily be saving their life, but improving their quality of life really goes a long way. And I find great satisfaction in that.
Couldn't agree more. I think there's a huge burden. Venous disease is 5 times more prevalent as compared to arterial disease. It's the number one cause for lower extremity ulcers. But yet, the perception of venous disease is really not as glamorous. It's not as highly valued. It's not as highly um, regarded. And you've done some research in this before recently. Can you tell us a little bit about your research looking at perceptions of venous disease and how it may influence a young practitioner who may be trying to decide what type of practice they want to start?
Absolutely. I think one of the things that we've really learned is that venous disease is very chronic and it progresses, but at a kind of a slower rate, I think, than arterial disease. And as well, it doesn't carry that same mortality and morbidity that arterial disease does. Now, obviously, there are some exceptions, as if you've had pulmonary embolisms or significant VTEs. Obviously, that those carry a higher rate. But when you think about sort of what the sequelae of that is, which could be post-thrombotic syndrome, venous hypertension, all of those things, I really don't think that those things have the sort of acuity that arterial disease does. However, as you mentioned, it is of such high prevalence. And I think that's really the issue for us is as practitioners, we can't ignore. We cannot ignore this population who is suffering from this chronic disease. And so the perception, you're right, among practitioners is it may be less sexy. It may be less complicated. It may be less sort of acute sort of in need. But I think those things, that sort of view is very much changing because of sort of the interest in the fact that the prevalence is so high and that the quality are, especially in the US, a lot of our advancements are patient driven. And I think patients are speaking up and saying, listen, in my quality of life, it is not good. I do not like the fact that my legs feel achy, that they feel tired, that they have post-thrombotic changes. And I think because they are speaking out with support from advocates like those interested in venous disease, I think it's really pushed that viewpoint of, you're right, we really have not advanced the treatments for venous disease as far as we can. I think there's a lot of emphasis on arterial disease, and I think it's great. I think we've come, just so much developments have happened in the last 50 years. But I think the same is definitely also happening. That shift is also happening in terms of the minimally invasive techniques, how we treat pulmonary embolisms, how we even treat post-thrombotic syndrome now. I mean, think of all the stents that we've really had in the past 10 years. I think that the approval for a lot of these stents, I think, were very much accelerated by the fact that we needed these venous dedicated stents. So I agree with the fact that the viewpoint, I think, will stay for quite some time. But for anybody who is looking to see where can I focus my practice, it's just untapped potential of just advancement. You can really make a difference. And there's such opportunity for research to advance this portion of vascular disease that if this is something that you really feel passionate about, really, the sky's your limit.
I find that because the field of venous treatment diagnosis is really vastly underdeveloped. Um, there's a lot more gaps. We have very little RCT data, embarrassingly so. And that's just not the US or Western Europe, that's worldwide.
Worldwide.
And I want to talk a little bit about some of the influences and contacts that you've been developing worldwide because you've had an influence, you're increasing in influence, you're really one of the rising stars in our field. How do you find some of that interplay that you see from other countries who have different tools, different techniques, different ideas, sometimes more developed, sometimes less developed, sometimes things that we don't have available here in the US? How do you leverage those different ideas to help you and your patients?
Absolutely. I mean, I think research is really something that really needs to be global. And one of the things I would say is, just like you had mentioned, right, is that it is under there's the prevalence is so high, but it's under recognized in terms of importance, under recognized in terms of the importance of research. It's just there's so many gaps everywhere. And I think the fact of the matter is that these sort of gaps occur because of the fact that research is still a little bit lagging behind. And I think that there's sort of a synergy that we need patients who really need the research, and then we have to have people who are willing to do the research. And that willingness to do the research, I think, comes from the fact that I do think that there is a need for this let's learn from each other sort of globalization of research. And I do think, as Anil, from the AVLS and really the societies such as the AVF, all of those really bring us all together with this common goal of being able to move the field of venous surgery, venous disease, treatment of this forward. And I think it's really the collaborative efforts of all of us that's really going to decrease sort of the gaps. I do think globalization of this sort of research is going to really decrease the inequities and the gaps that we have. And I think that globalization, to be honest, of research will also standardize the care that we give to our patients.
Well, I have to thank researchers such as yourself who have been trying to bridge some of those gaps and push the field forward because I agree with you. I think pushing the envelope is the way forward. I think vascular surgeons and are some of our partners who really do a good job in this field. We have some excellent work and we have some great, exciting new tools that are coming down the pike to help further the field and our patients.
Well, thank you
Thank
so
you.
much, Anil, and I look forward to many more conversations like this so that we could really push the field forward.
Thank you.